Kia koto. I am very sorry not to be at Ōtāutahi. I was really looking forward to this networking opportunity. I've really enjoyed the living streets out here on meetings and especially the walking summits. So next time. But look, I'm going to make a start and basically talk about a project that I have presented early findings of about 3 years ago. But I think it's really relevant, and I especially enjoyed the sessions I've been able to join a link into virtually, many of which actually intersect with the interests that this presentation will have. Effectively want to talk to you about what we've learned from the Inclusive Streets project, which is actually called Inclusive Streets in Tāmaki, Makaurau. And I would say basically the take-home message was mind the intersections. And by intersections, I don't mean the ones which have traffic lights on them. They're slightly different concept. Any of you who are social scientists will know of intersectionality theory. This is not a theoretical presentation though, but let me just get on and tell you where this comment comes from. Those of you who might remember this project, when I first presented it in Tāmaki, Makaurau a few years back, it was initiated because we were conscious that Tāmaki, Makaurau, which is way behind Ōtāutahi, I have to say, in terms of some aspects of walking and infrastructure to support it, was getting in the zone and encouraging cycling and walking. I was conscious as a clinician and a public health professional that really these opportunities were not as obvious and available to everybody, particularly older people and disabled people. This has come through in presentations already this morning. Now, the questions that prompted us were, how do the transport systems as we have them really influence opportunities for active travel, walking and getting about for older people and for disabled people of all ages in Tāmaki, Makaurau? And how do transport professionals perceive their practices in relation to these realities of challenges of the built environment? We, in this project, undertook 62 go-along interviews. These are qualitative interviews, talking to people as they went on a journey to the extent they could, using photo voice. A third of those participants were Maori, a third Pacific, and a third were Pākehā or Chinese because of the suburbs we were working in. There were 4 case study areas in the west, the south, the east and central Auckland. And we also did surveys of about 175 transport professionals and 21 key informant interviews, all transport professionals of different stripes and national, local and regional spaces. We had 8 interactive community workshops, predominantly in those case study areas. Just got some pictures of what they used to look like. They were highly engaged, predominantly enabling people who were challenged by the built environment to talk about what would make them enjoy exactly what you are wishing everyone to enjoy in this meeting. Now, I want to note one particular case study that was really, for us, probably the pivot for this. And perhaps the most concerning. So Te Puia Memorial Marae, which those of you from Tāmaki, Makaurau might know. Others of you actually will probably be whizzing past if you ever flew to Auckland Airport and were going to the CBD, because the Southwestern Motorway, which is the motorway you'd take if you were driving in from Auckland Airport to CBD, effectively built in the 1980s, transected the access, amputated, you could say, the access that people at this marae had to everything they enjoyed in terms of their ability to access the urupa, the moana, the harakeke, things that they basically valued as Maori growing older in place, effectively were taken away from them by the motorway, because they just could not. You can see the pictures I've got here. This is right in the middle, is basically the kind of footpath they're expected to walk right now. You can imagine how appealing that would be. And the overbridge effectively is pretty much impassable for anyone who's older and who has mobility challenges. And the road closed sign at the bottom there is effectively what it looks like even 40 years after this motorway was built, where ambulances still get lost trying to get to the marae because the road they would normally use according to their navigation system, GPS, actually is blocked off. Now, there's anthropologists like Dennis Rogers who call this infrastructure violence. Whatever we call it, I think it is effectively a hugely damaging implication for people who are living in this marae, who continue to live in this marae, and it has impacts for their mokos, who basically, as one of the Kaumatua told us, the marae is there, supposed to be there for our whānau, but the motorway stopped the kids coming. The parents come first, they come to nurture the marae, but they don't because the kids have nowhere to go, it's not safe. So what happens over the years takes away the tikanga. One of the Kaumatua that we interviewed, who actually was entirely dependent on a carer to basically help her with her daily needs, says, I'd like to make trips. I'd like to get out and walk like other people would, but there's no buses, no way out. Some people not like me, they walk up because they're capable of walking up to the bridge and to go all over wherever the pension card can take you. If you're not capable of doing that, then it's look outside the window. Yep, see the big world. Hello, here I am. You can see the pain in this voice. And I think it is really remarkable for me that people were still able to engage with talking about this reality. Only one person in the Papakainga, in the Kaumatua flats in the marae owned a car, and he has passed on. Now, in contrast, one of the other case study sites was in Howick, East Auckland. It's still the county's Makaurau, which is where I work. It's amazing what the effect of power and privilege can achieve. So this was the oldest community that we were interviewing, high levels of education, computer literacy and systems knowledge, which effectively meant when things were not going well, most of them were able to figure out what to do about it. And just as an example, this is one of the older people I've been interviewed who actually used her iPad to get around places by bus and did quite a lot of stuff. And she was, one particular time, the bus had overshot the park she was supposed to get off at. And when she complained, the bus driver said, fussy old lady. She says, I heard that, came home, storming off, sent off a complaint, got a reply back the next day, which is most unusual for Auckland Transport, saying we will talk to or interview the driver, and if necessary, he will be sent off for more customer service training. Now, regardless of that intervention and how successful that is, it was symbolic of what a lot of people in Howick were very able to do and did. Many of them actually sat on boards, citizens advice bureaus, council meetings. They knew how to advocate for themselves and for others like themselves. Cleanliness, which is one of the other case study sites, was interesting. This is a relatively low-income area, rapidly getting gentrified, and therefore potentially having more issues for the Maori and Pacific and older and low-income communities who are getting more displaced. But those who were still able to reside in Gleninus, because of what Gleninus is like, it's a relatively flat suburb with a train station right near the village center, a bus hub. There's a lot more public transport and connectivity here. And people in the community really loved their community and the places they could get to. So although they were the youngest, there was a lot of comorbidities, a lot of health issues, but many expressed a real love and care for Gleninus, its shops, its community, and the environment. As one person who was needing a wheelchair to get about and was waiting for an operation and was in quite a lot of chronic pain, talked with this quote of how even if there was a lot he was contending with, his spirit soared, his happiness and his ability to make the most of the day was so much the greater because of the fact that he was able to get around, and he liked to get around to get the distraction from the suffering. So I think it is kind of interesting to know that it doesn't always mean that if you are Maori Pacific low-income neighborhood, that things are necessarily bad. This is an opportunity to talk about, obviously, a place like Gleninus, which for various reasons are making the opportunities and accessibility for well-being that much more likely. So what did we learn from the transport professionals? This is mentioned surveys and informal interviews. They were concerned that really, despite the rhetoric, there's a disconnect from vision and policy from the top compared to how things can be delivered on the ground for multiple reasons that most of you would be familiar with. They are concerned that some members or types of public are not engaged or heard. They're very aware that there is limited responsiveness to facility. Māori are often seen as a group to be consulted rather than in terms of the rights to kawanatanga, tirunanga, siratanga, or oretetanga. And the reality here is, while there's an increasing awareness, there is still quite a long way to go in enabling the realities to be considered actively and moved into practice. There's an unspoken minimization of accessibility in planning guides and monitoring frameworks, probably very familiar to all of you and everyone who's advocating in this space. And the outcome measures to figure out who is and isn't enabled to participate in walking are also challenged by the fact that, in contrast to road safety, where crash-related injuries, deaths, hospitalizations are counted on a regular basis, there isn't an obvious measure for trips that are not made. So, as a few quotes, just a couple, I think most people, and this is from transport professionals, I think most people who work within our industry are aware of the need for and benefits of facilities that improve accessibility, but priorities still tend to be set with the primary focus being capacity for motor vehicles. And lastly, most designers are able-bodied and drive everywhere. So just telling them that it sucks for people in wheelchairs isn't going to have much meaning. I know that one of the people I saw online was Vivian Naylor, and I know Vivian's been doing some amazing work, as have many of the rest of you, Karina and others. This is such a familiar story that I think it's kind of, to me, beggars belief that we are still talking about it in the way we do. So when I talk about minding the intersections, I'm talking about the intersections between people, places, plans, and practices. What we have in terms of infrastructure, privilege for some can have devastating consequences for others, particularly bear in mind that motorway that makes it much easier for me to whiz from the Auckland airport to the CBD in so much quicker time, but at what cost? I don't even see it anymore unless I know that Marae is just on the side of the motorway. I just didn't see it. It is very strongly, these infrastructure and other planning inequities are very strongly patterned by power and privilege. The Kaumatua in that marae protested vehemently at the time the motorway was being built and have continued to do so. And there's many other examples like that where this doesn't necessarily mean things have changed. Some forms of marginalization, whether it's age, disability, low income, or ethnic minority, they are not independent of each other. They tend to coalesce and intensify differences. As we know, many more Māori and Pacifica people are likely to be disabled in the disability survey. Our transport plans and consultation processes, professional practices, and monitoring systems tend to reproduce, and amplify the inequities. That's what we have learned from this project. So I guess what I want to end with here is that there is no shortage of, while there's no traffic light here, there is an opportunity here for us to stop and think about what these intersections mean in our day-to-day work. And this last post-it notice from one of the community hui that we had, where the community was saying we would like all the council, local boards, transport planners to come here and whakarongo to us. So it's not a lack of interest. They're not hard to reach. These are people who are underserved, and we can do something about it. I think the sorts of questions we could ask is, who are we consulting with? Who complains and who doesn't? How do we consider trips not made? What does all of this mean to us personally? We are not just a system. We're not talking about a system. Systems are created and sustained and perpetuated by human beings. So what do we do in our day jobs? Then to what extent do we intentionally address planning, policy, and practice gaps to ensure that people challenged by our transport systems can enjoy the pleasures of walking and active travel that you're all talking about, and I'm so enjoying hearing. So these are the questions to address. I will finish with the acknowledgements of the project team, and thank you very much for this opportunity to have spoken with you.